What is informed consent, and why is it important for mental health professionals? Hi, I'm Markeisha, and today I'm going to be talking about informed consent as a requirement for mental health professionals. I will cover what it is, what medical professions are required to include according to medical ethics guidelines, and finish with easy ways to find a template or form to use. Let's get started. Before beginning any type of clinical activity, healthcare providers typically describe to a patient what they plan to do, what they hope will happen after the visit, and any risks or side effects the patient may face. Then it is your right as a patient to either agree to the plan or not. Without taking these necessary steps and documenting them, it is unethical to proceed with treatment. Legally, it could even land the doctor in some hot water. The process of sharing information and obtaining permission is known as informed consent. It is the accepted standard of care for all branches of medicine. It's required in healthcare fields such as research, device approval, clinical practice, and in this case, psychology. Informed consent is mandatory in the mental health field. Many professionals work in the field of mental health. It's not just psychologists that have to have signed consent forms from their patients before beginning treatment. This also applies to therapists, clinical social workers, and counselors. According to Katie Zisking, a licensed marriage and family therapist who owns Wisdom Within Counseling, quote, informed consent should cover everything regarding what the client can expect from treatment and how you run your therapy practice. Your client will sign legal documents that cover your practice and privacy policies, but they will also sign an informed consent form for psychotherapy before seeing you, the therapist. Informed consent is part of an ethical code for mental health professionals. The most influential of these codes is the Ethical Principles of Psychologists and Code of Conduct from the American Psychological Association, or APA. Here's what they had to say. Section 310 of the Code of Ethics tells psychologists that they should get informed consent before they diagnose or treat a patient. Later on, they go about describing the specific information psychologists should include on their consent documents. They should provide the following details: how and why the psychologist wants to assess, evaluate, or diagnose the patient, the cost of treatment, any third parties that will participate in the assessment, like testing labs, for instance, the patient's confidentiality rights and the limits of those rights, and offer to discuss the activity further prior to signing the form. An informed consent document for someone entering therapy would include the last 4 items on that list, as well as the details on the nature and anticipated course of therapy, Section 10.1. Informed consent documents for a psychological research study, however, are much more involved. Section 802 requires the researchers to explain what the research will entail and why the researchers are conducting it, the subject's freedom to quit the study whenever they want, what, if anything, will happen if they do quit the study, potential risks, negative side effects, and anything else that may make the subject want to quit the study, the benefits of the research to the subject and/or the science of psychology, the subject's rights to confidentiality and/or lack thereof, how much, if any, the study pays, who to contact for answers to questions about any of the above. The American Psychological Association's ethical principles require that simple, clear language that non-medical people can easily understand be used. Whether done verbally, electronically, or via photocopy, the patient's consent must be documented. Something as simple as a signature will work. In Section 310, the APA notes the changing nature of obtaining patient signatures. When a psychologist treats someone in person, they traditionally have a stack of clipboards ready to go, loaded up with informed consent pages ready for signature. However, telehealth providers need online forms, which Jotform conveniently offers. Jotform consent documentation is simple and customizable. A mental health professional simply needs to pick an informed consent template and edit it to fit their practice. Or they can start from scratch and use Jotform's drag and drop form builder to create a polished, user-friendly form. And of course, the form must be HIPAA compliant. By the way, these forms can be used for any medical field, not just those in the mental health field. Let's recap. Informed consent is a requirement of mental health visits. This is guided by a code of ethics. There is certain information that the documentation must contain depending on if it is a simple visit or a research study. Informed consent forms must be kept on hand and are one of many that can be created on Jotform. Thanks for watching. For now, this is Markeisha, signing off.